Hi everyone, in this video we are going to discuss about diagnosis of pregnancy. See, basically diagnosis of pregnancy starts from the patient's symptoms and signs itself. Okay, so it can be elicited by history taking or examination or performing laboratory tests including estimating HCG values in urine or serum and radiodiagnostic methods like ultrasonogram. Okay. So, history taking and examination can be suggestive of pregnancy. Laboratory test can diagnose pregnancy, but only your ultrasonogram is going to confirm the pregnancy. Okay. So, even by whichever method, by history taking, examination or by estimating HCG values, you suspect a pregnancy, finally you have to confirm it by ultrasonogram. Until and otherwise, pregnancy is not confirmed, right? Okay. Now, in this session, I am going to concentrate only upon the laboratory test. Okay. So, we know we are going to discuss about the hormone, human chorionic gonadotropin. A short revision on this hormone. So, it is produced by syncytio trophoblast cells. This is a glycoprotein. It has two subunits, say alpha and beta. Alpha is similar to other hormones like luteinizing hormone, follicle stimulating hormone and thyroid stimulating hormone. Beta hormone is only specific to this. So, basically in our diagnostic test, we are going to take this beta hormone only. Okay. Then, what is the half-life of the hormone? It's around 36 hours. And this hormone is seen as early as 8 weeks of gestational age and it peaks around 10 to 12 weeks of gestational age and it starts declining from 10 weeks onwards and then it reaches a plateau between 16 to 20 weeks and the same values maintained till term and after delivery it is cleared from the blood by 48 hours or 2 days. Okay. Basically, the hormone HCG is going for a increase in a doubling method. Okay. So, what is this doubling? If you measure beta HCG on day 1 and beta HCG 48 hours later, there will be an increase in HCG by 33%. Okay. So, this is doubling. And this doubling is normal in intrauterine pregnancy. Okay. Also, HCG can be measured from urine or serum. So, we can understand that HCG first rises in the serum, then only it is seen in the urine, right? So, serum levels of HCG rise earlier. Okay? So, if we see pregnancy tests, this can be done in either urine or serum. Okay? So, we'll take urine pregnancy test first. So, this is a qualitative method of testing HCG hormone, and it is the most commonly done method to diagnose pregnancy. It can be done easily at either your home or a clinic setup or a hospital. Okay. Mostly these tests are done when a woman misses her menstrual cycle. So, mostly 45 days of amenorrhea, the woman will come for urine pregnancy test, or she herself will do a urine pregnancy test. And urine pregnancy test can be done either using a urine pregnancy strip or a urine pregnancy cord, and the hormone is received from the urine from the early morning first voided sample of urine. Okay, because in this urine the levels of beta HCG are high. Okay, and what is the method used to diagnose urine pregnancy test is? It is sandwich ELISA method. Important. Okay, so if the urine becomes positive for pregnancy, then there will be two lines in the cord. That means a positive urine pregnancy test. When there is a single line or no lines, then it is a negative urine pregnancy test. Now we will see the serum urine pregnancy test. This is a quantitative method of assessment of beta HCG, because we will be measuring how much value of HCG is present. Okay, and this is not a commonly done method. Okay, usually serum HCG is tested in certain conditions, like for example, if the woman is undergoing artificial reproductive techniques, or if there is a need for follow-up of molar pregnancy after its evacuation, or if there is a suspicious ectopic pregnancy. Okay. Now, we will see a case scenario, like say a 22-year-old female came with complaints of amenorrhea and a urine pregnancy test positive at home. Okay. So, how we will follow up this woman? We have to do serial serum HCG monitoring. Okay. So, for example, we will see HCG on day 1 and make a note of it. Okay. Noted. Then we will leave day 2 and ask her to come on day 3, which is 48 days later, and the sample will be repeated. Okay. So, there can be 3 scenarios. Okay. Either it can be a normal intrauterine pregnancy, or it can be a ectopic pregnancy, or it can be a abortion. So, if it is a normal intrauterine pregnancy, doubling of beta HCG values will be seen. Already I told you that there will be 33% increase in HCG values. And in ectopic pregnancy, the values are certainly going to increase, but it is not as much as 33%. Okay, it will be some plus or minus 10% of the previous value. Okay, and in abortion, the values will be decreasing. Okay, so these are the 3 case scenarios we can have. Okay, and then there are various methods used for measuring serum HCG. Okay, those include fluoroimmunosorbent assay, radioimmunosorbent assay, then enzyme linked immunosorbent assay, or immunoradiometric assay. Okay, we will see one by one, and some other methods are also there. For now, we will learn about these 4 types only. Okay, and if we see the sensitivity of these tests in order, it is the same order of sensitivity. So, it is going to be fluoroimmunoassay, followed by radioimmunoassay, followed by ELISA, and followed by immunoradiometric assay. Okay, but the most commonly done test among this is ELISA. Okay, fluoroimmunoassay radioimmunoassay, then enzyme linked immunosorbent assay, then immunoradiometric assay. Okay, we will see how the sensitivity of these tests are there. It is just in the same order. Okay, there are so many tests also. I am not going in detail for discussion of those tests. Okay, so It is, the order of sensitivity is also the same thing. It is FIA, RIA, ELISA followed by immunoradiometric assay. Okay, we will see all these tests one by one. In fluoroimmunoassay, antibody tagged with fluorescent label is used. Okay, and we all know that this is the most sensitive test and the results can be obtained within 2 to 3 hours. Okay. Next is radioimmunoassay. This is also one of the most accurate test and it can be performed as early as 8 weeks after fertilization. Okay, and results can be obtained within 4 hours, but exposure to radioactivity is a problem. Okay. Next is ELISA, enzyme linked immunosorbent assay. Okay. So this is the most commonly done method. It can be done on urine or serum and the results can be obtained between 5 to 15 minutes. Okay. What we are going to do is, first we are going to send a antibody targeting the HCG. Okay. So there is HCG. This antibody is going to bind to this. Okay. Now after this, we are going to send a second antibody bound with an enzyme. Okay. So there is a second antibody bound with the enzyme. Okay. Now what we are going to do is, we are going to add substrate to the enzyme added. Okay. So suppose this is the substrate to the enzyme. Now this enzyme substrate complex is going to form and this is going to produce color intensity. This enzyme substrate complex is going to produce a color. So based upon the intensity of the color developed, will be confirming the pregnancy. Okay. Next is immunoradiometric assay. So this can be done faster than radioimmunoassay, but we all know radioimmunoassay is more sensitive and it will be completed within a time of 2 to 30 minutes. What we'll be going to do in this test is, we'll be taking the antigen we are targeting, that is the HCG hormone, and we'll be sending two monoclonal antibodies targeting different sites of the antigen. Okay, 1 and 2. So this first antibody is bound to iodine 125 and the second antibody is bound to some magnetized particles. Okay. Now after adding this, the whole of this we are going to incubate at 31 degrees Celsius for about an hour, that is 60 minutes. Okay. After this, we'll be washing the substrate and the unbound antibodies will be measured. Okay. Fine. Now we'll come to the ultrasound confirmation of pregnancy. I am going to give you only some hint points. I am going to give you only some hint points in this video. Okay. So, while diagnosing pregnancy via ultrasound, the first structure we'll be able to see is the G-sac. Then comes a yolk sac inside the G-sac, and then a fetal pole develops, and then finally cardiac activity comes in the fetal pole. Okay. Now, we can use both transvaginal ultrasonogram and transabdominal ultrasonogram to confirm pregnancy. Okay. And the approximate range of beta HCG values for the diagnosis through this ultrasonograms, for TVS this should be around 1000 to 1500 international units per milliliter, and for TAS this should be between 3500 to 6000 international units per milliliter. Okay. So, if we take via TVS and via TAS, remember always TVS is the first mode of investigation we do in early pregnancy. Okay. So, if we see in TVS, G-sac is seen around 4.5 weeks, that is 4 weeks and 5 days, and TAS it is exactly seen 1 week later, so that is 5.5 weeks, that is 5 weeks and 5 days. And the yolk sac in TVS is seen around 5 weeks, and the fetal pole is seen around 6 weeks. Cardiac activity can also be seen by 6 weeks in TVS. Whereas in TAS it is exactly 1 week later. So it is around 6 weeks for yolk sacs, around 7 weeks for fetal pole, and around 7 weeks for cardiac activity. Okay. With this, we are completing the topic on diagnosis of pregnancy. Until we meet in the next video, happy learning, keep going and take care.